The colon, the source of the bleeding, it's called diverticulosis, or
We didn't really hear that.
No.
The bleeding,
Uh-huh.
what I was explained was that it might be in the small intestines,
yeah.
and it was in an area that would probably be untreatable.
So yeah, I'm looking through things here. We'll talk about the bleeding and then we'll talk about the kidneys. So they found that you have something called diverticulosis, which is a pouch, a balloon-like things. Could be the source of the bleeding, could not be the source of the bleeding. If they don't think that it's the source of the bleeding, then the other thing done, right, is talking about, it's called AVM or AV malformations, arteriovenous malformations. What is that? Gibberish to you, right? So it's like a clump of blood vessels that gets opinionated. Every once in a while will bleed. God knows why does it bleed, and then you lose all of that blood. It's very, very, very difficult to detect by the usual methods that they've done for you in the hospital. The scans and the scopes might not be able to pinpoint where it is, might not be able to detect it. So they recommended for you to do a capsule, right? Did they tell you about that? Yeah, it's mentioned here that might consider an M2 study, which is a capsule that you swallow. It goes all through your intestine and it takes pictures, and then you excrete it with your bowel movement. The pictures get sent to a centralized computer.
Didn't they have something done like that?
I don't believe so.
Or a camera? Yeah, I thought I did.
Well, the
no,
camera is the
was.
one.
Oh, excuse me.
Sorry.
That would have been probably the EGD that
Right.
you had. This would be
Right.
like swallowing something,
Yeah,
not.
so who saw you there in the hospital? Did you get follow-up arrangement with the gastroenterology?
The doctor that did the
Scope, the
EGD.
camera,
I spoke with him, and my sister Jana spoke with him after the surgery. But we really, I believe, Dr. Allen.
Alan?
Yeah, I don't think we ever saw him again.
Yeah, if you run into this, not my field, it's the gastroenterology, but if you keep running into this issue, God forbid, and you keep having those repeated episodes of anemia, you need that study to be done, okay? But I would, not really sure if they, let me see if they have recommended for you.
I thought I saw that Dr. Allen.
He may have come in. I wasn't there. Is all I can say is.
Yeah, they recommended for you to see the GI services in 2 to 4 weeks. Here. To follow up with her primary care in the next couple of weeks and the GI services in the next 2 to 4 weeks.
Okay, we do have an appointment with her primary.
Yeah.
But really, we need this. Okay.
Yeah, you need to see the gastroenterologist. Okay, that's where.
And who is that?
Yeah, because what has happened is that, let me show you. I need to show you what I'm talking about specifically here. Bear with me a second. Duodenal AVM.
Mm-hmm.
They did the colonizations for it back in 2022.
Yes.
Well, this time they didn't find it, but it tends to happen and recur. So that's why you need a follow-up with the gastroenterologist.
Who is that?
That's the GI, the stomach doctor.
That's probably, is that Dr. Allen?
Yeah, that's Dr.
Yes,
Allen.
yes.
Okay.
So, on the kidney side, what's your understanding about the kidney side? What did they, you saw a couple of physicians, Dr. Mo and you saw Dr. Nieves in the hospital. What did they tell you about this kidney deal?
I don't know.
I wasn't with her when Dr. Mo, she had the visit with Dr. Mo, but I have spoken with my sister, and it didn't seem like there was really much discussion aside from, cut down on her salt intake, maybe some dietary changes, go back to the primary and see if.
What did that Dr. Bach do?
Well, no, this isn't Dr. Bach.
Okay.
No, this is.
Bach is urology. That's the surgeon. That's the person who cuts on people. I don't cut on people.
Okay.
We follow the kidney function level. But I needed to know from Don and from you what was explained for you. That way I follow up on what was explained for you. I'll show you whatever is available here, okay? It's kidney numbers and images, okay? Let me show you.
We really haven't gained that much, aside from seeing the lab work numbers from, how many, gosh, she's had so many lab works.
Right.
And we realize, sometimes her creatinine gets high, that's her, and so many of these are out of the range, but they're kind of steady, but every so often, maybe the potassium goes way out of balance, or the ratio number is a very critical one, isn't it?
Yeah, so let me show you, and I will talk about that. So, the deal that happened with you in Menorah was a mass that was causing blockage of the draining system of your kidney. They took it out, and it's a done deal. On the scan that they did for you, and those were from September the 3rd, I'm not really sure if anybody had talked with you about him or not, but you have what's called cysts on the kidney. They're called multiple bilateral renal cysts. What is that? I have a model somewhere in here, but somebody took it. Let me see if it's in the other room. I'll show you what this looked like, okay? It's better to understand things, okay?
You understand what he's saying?
I'm listening. Yeah, he's trying to explain things. Yeah.
Is this real serious? Is it a cyst?
I think Dr. Bach has mentioned this.
Has he?
Yes, he has. I don't think this is anything major that he was concerned about. I mean,
Oh, good, okay. I'm sure it just got moved.
So, the kidney should look like that, smooth cells. That's the normal kidney. This is the cystic kidney. See the difference? What are those? Those are bulges, okay, in the wall of your intestine. And those bulges in the wall of the intestine will unfortunately cause your kidney to malfunction based on how many were there, okay, how much of them are small, how much of them are big, how many of those are growing, how many of those are disintegrating or regressing. So, with that being said, this gets reflected on the kidney function level being up and down, being up and down, being up and down. Now, what's the kidney function level? The kidney function level is a number by which we decide about the filtration capacity of your kidney. It's called creatinine. It's a medical term. You following with me? Am I going too fast?
No.
Should I explain it in another way?
I don't think any of us have really understood what the creatinine level is.
So,
but we see the number. We always see the number as being flagged.
So, the creatinine is the number by which we measure your kidney filtration capacity. Simple. It's a blood test.
Okay.
Ideally, that creatinine should be anywhere from, for an individual in your age, should be anywhere from 1.1 to 1.3. That's the normal range.
And what's mine?
Well, you're all over the places. You've never been normal. So this is dating back to September 2022. 2.1, 1.8, 1.6, 1.9, 2, 1.9, 2.9, 2.5, 2.2, 2.4. So you have what we call kidney dysfunction or kidney failure. They used to call it kidney failure. People got scared of the word, so they changed it to kidney dysfunction. Because when the patient hears kidney failure, they immediately start thinking about dialysis. Oh my God, my kidneys are failing, I'm going to go on dialysis.
Right.
So they changed the name to what they call it right now, chronic kidney disease or chronic kidney dysfunction, or abbreviated CKD. Clear?
Okay.
You're starting to get the idea here? A little bit?
So how serious is this?
Well, this is
Well,
what I'm
most-
getting at. There's so you take this number and you put it in an equation. And the equation tells you about your kidney filtration capacity. Now, there are stages for the kidney filtration capacity based on this number here. The acceptable level for the kidney filtration percentage or capacity is 59 or higher. Okay? Where are you? 22, 27, 29, 24, 24, 25, 15, 17, 20, 19. You following with me?
Yes.
So,
Not very
based,
good. Not very good.
yeah, well, based on that number,
Mm-hmm.
you decide about the kidney disease stage. Less than 15, it's called stage 5 chronic kidney disease. That's the most advanced kidney disease level. Less than 15 on the filtration capacity. 15 to 29, it's called stage 4 kidney disease. Did you notice your level? It was never greater than 19. It's anywhere from 15 to 29. So your best value was 29 here. Your worst value was 15. Less than 15 is called stage 5. 15 to 29 is called stage 4. So you have stage 4 chronic kidney disease. Not the most advanced stage, the stage below that. That's what you have. Why do you have it? It's the combination of all of what we've just talked about. The cysts, the blockage that you had, and then we're gonna go over the other stuff when I go over your medications. Okay, what needs to be done for it? Well, it depends. If you feel okay and you don't have symptoms, and I'll tell you what those symptoms, we could continue to watch and babysit those kidneys. They might improve. If they improve, I'm gonna be happy. They might suffice you for the rest of your life without the need to do anything other than just fine-tuning of your medication.
What typically causes? She hasn't had that many changes in her medication over the last, and I don't know how serious or.
Yeah. So.
But what causes those changes or fluctuations in that number? I guess.
Well, cysts,
Yeah.
water intake, salt intake, and then some of the medication. Do you have the list of the medication? No, those are my papers. Did you get a paper?
brought 'em in.
Yeah.
Oh, I did not take it. Is it in your bag?
No.
You brought it in,
I
and
brought it in and laid it down.
Oh, that's strange. I didn't take
well,
it.
they gave her one at the desk,
Yeah.
and she was supposed to cross off. Did we leave it outside?
Did you
Did
leave it
you-
outside? Or, well, no, it's not here. Those are all mine from the hospital. 1 second, let me look at it.
In the waiting room, we were in the right corner.
I thought I brought it in and laid it down.
Let me see.